So we've talked about how maternal poverty manifests itself in harm for the child as soon as they are born, particularly in being born with a low birth weight. And we've talked about how being born low birth weight can impact a child's capabilities, such as through bodily health and educational attainment issues. But now, we want to focus on what causes this disadvantage by examining the ways in which the mother's actions, while experiencing poverty and while pregnant, are constrained in a way that impacts her child, and can lead to being born low birth weight. There are many reasons why babies can be born low birth weight, which mostly occurs when babies are born prematurely. We want to focus on two pressing causes that relate to poverty: increased maternal stress or anxiety, and a lack of access to prenatal care. Using individual explanations for why mothers experiencing poverty are more likely to face increased stress or lack of quality of prenatal health care is not enough. In fact, using explanations that blame mothers for choices they made while experiencing both poverty and pregnancy causes us to miss the bigger picture, that there are structures at play which reduce the choice options these mothers have. To examine these structures at play that influence the mother's actions in a comprehensible way, we're going to follow two hypothetical stories that are based on real-life experiences. These stories will not cover everyone's experiences, not even close, but they will highlight how social structures constrain a mother's actions in ways that could result in her baby being born low birth weight. As defined by Eastwood and Smith, social structures are long-lasting, individual, connecting aspects of the social environment around us that both enable and constrain the actions of all individuals.
Let's say there's a single mom, Sandy, who is pregnant and experiencing poverty. This is not uncommon. According to the National Women's Law Center, the poverty rate for families headed by single mothers was 31% in 2019, compared to 5% of married couple families. When those single mothers are also people of color, their likelihood to experience poverty is even worse. Sandy used to have a partner, but she left him after he became physically abusive towards her while she was pregnant, which happens to over 320,000 pregnant women per year. Sandy also knew that the combined household income between her and her spouse could cause her to lose 1/3 of her welfare benefits on average. As a single pregnant mother experiencing poverty, Sandy doesn't have the built-in extra support of a spouse, so she is burdened with the stress of being the sole income provider for herself and her child. But she faces difficulty finding employment, like 59% of single parents also reported in 2021, because employers fear her instability as a worker, and being a single parent does not fall under federal anti-discrimination protection. Without a job, Sandy does not have access to health insurance, reducing her ability to receive quality prenatal care, which costs about $2,000 on average without insurance. Sandy is also hesitant to talk to social workers, welfare officials, health officials, or employers about her needs because of the overwhelming fear of being judged or punished due to the stereotype that mothers in poverty are lazy and neglectful, having children just to receive more welfare benefits, or are engaging in drugs and prostitution. So Sandy often lies about her realities of her hardships, especially because telling the truth bears the risk of losing her child to CPS or sacrificing her welfare benefits in the face of constantly changing definitions of eligibility and fraud. As one real-life mother experiencing poverty said, "It's like you can't tell the truth because you lose everything if you do."
Let's say Jane is a junior in high school. She started feeling nauseated every morning, so her friend told her to take a pregnancy test. It came back positive. Let's back up and think about how Jane might have gotten pregnant as a teen in the first place. Maybe Jane goes to a school without adequate sex ed, or with an abstinence-only program. That wouldn't be unusual. Around 42.5% of high schoolers still report not receiving formal instruction about birth control methods, according to Columbia School of Public Health. Jane could also be a victim of sexual abuse or assault. According to the Guttmacher Institute, research indicates that between 15 and 62% of teen moms have experienced sexual abuse. Not only is Jane pregnant, but she's also experiencing poverty. There are several reasons why Jane might be having that experience, and especially have difficulties accessing prenatal care. Jane's family could also be experiencing poverty. Growing up poor is associated with higher teen pregnancy rates, according to Penman-Aguilar and her team of researchers. Or maybe Jane got kicked out of her house because of her pregnancy. Jane could also be affected by lower labor market opportunities if she doesn't graduate high school. The CDC reports that only 50% of teen moms graduate high school by 22. So, how might Jane's situation, constrained through the structures we've been discussing, affect her pregnancy? She might be afraid that she will lose her child. One study by Maureen Heeman and a team of researchers found that some women do not seek prenatal care because they are afraid that Child Protective Services will take their child away. Jane also knows that her family and friends will likely reject her or treat her differently if she acknowledges her pregnancy. One real-life teen mom reported in Teen Vogue that her friends dropped her after they found out she was pregnant, so Jane has good reason to think this might happen. The stigma of being a teen mom, or fear of how their parents might respond, is a huge reason that teen moms don't seek prenatal care, according to Sally Hughes and Laurie Grubbs' research.
Linda and Jane's actions would be even more constrained when you consider the structure of race. According to the United Department of Health and Human Services, the low birth weight rate for black mothers has been at least twice the corresponding rate for white mothers for decades. This huge difference points to the fact that racism and its effects are factors in the health disparities in pregnancy outcomes and babies' health. Reasons why this disparity exists may be that African Americans in the United States have a distrust in the healthcare system. Research done by the American Public Health Association has shown that blacks are much less likely to report trust in their physicians and hospitals, thus leading them to be less likely to seek treatment and prenatal care. Furthermore, medicine has a history of bias, where there is a stereotype that leads to doctors not believing when black women are in pain. A 2016 study found that nearly half of first and second year medical students believe that black people have thicker skin than white people, and perceive black people as experiencing less pain than white people, an idea born from 19th century experiments that were conducted by a physician named Thomas Hamilton. Race seems to play a role as a structural barrier that leads to black mothers being at a far higher risk at experiencing low birth weight births than white mothers. It shows that structural explanations for causes of oppression are more important than only examining individual and biological reasons for why inequalities exist between groups. In our next project, we will be conducting an ethical analysis of our topic, where we will analyze whether the inequalities that lead to maternal poverty are justifiable or not. Thank you.